Hello, my name is Kendra Clark, physician assistant from Scottsdale, Arizona. Happy to present today 10 common mistakes when injecting neurotoxins. According to the American Academy of Plastic Surgeons, neurotoxin injections are currently the most common cosmetic procedure in the United States. Neurotoxins are used to eliminate expression lines by relaxing the facial muscles and are mainly used to smooth dynamic wrinkles, or smooth those wrinkles that form as a result of facial movements, such as frowning or squinting or smiling, and other expressions we tend to make every day. Together with dermal fillers are the mainstay of therapy for the prevention and the treatment of facial aging. So what is botulinum toxin type A, otherwise known as a neurotoxin? Botulinum toxin type A is a common ingredient in the injectable neurotoxins better known under brand names such as Botox Cosmetic, Dysport, or Xeomin. What is the difference between Botox, Dysport, and Xeomin? Well, the main distinction lies in their formulations, which influences the dosages used, how much of the product it may spread, the amount of accompanying protein or lack thereof, and how quickly the patient may see the results. For example, Botox Cosmetic is formulated with an accompanying protein named Clostridial protein, where Dysport contains a smaller version of that similar protein, while Xeomin does not contain the accompanying protein at all. However, all three products are FDA approved and have been used safely and effectively for years, and all are designed to address the same types of wrinkles and other cosmetic concerns. Since cosmetic botulinum toxins are purified in a lab and injected in very small amounts, these proteins do not cause botulism. How do neurotoxins actually work, and what is their mechanism of action? Well, botulinum toxin blocks neuromuscular transmission by binding to receptor sites on motor nerve terminals, then entering the motor nerve terminals and inhibiting the release of acetylcholine, which activates muscles. When injected into the muscle at therapeutic dosages, botulinum toxin produces a partial chemical denervation of the muscle, resulting in relaxation of the muscle. A Cliff Note version is, treatment works by blocking nerve impulses to the muscle, causing them to relax. The toxin requires about 24 to 72 hours to take effect, peaking at about 10 days, and the effect of botulinum toxin usually lasts about 12 to 16 weeks. Are these neurotoxins just for wrinkles? No. We have aesthetic and non-aesthetic indications for neurotoxins. Aesthetic indications include horizontal forehead lines, glabellar lines, also known as the levens between the eyebrows, wrinkles around the eyes, known as crow's feet, corners of the mouth, the cobblestone appearance of the chin, wrinkling of the nose, platysmal banding of the neck. Keep in mind that neurotoxins are most effective in dynamic muscles. Wrinkles that form in these areas are a result of facial movements like frowning and squinting and smiling and other expressions that we tend to make every day. It is important to find an injector with proper training, credentials, experience, an aesthetic eye, and a skillful technique. Your injector should have a thorough knowledge of facial anatomy, functionality of the muscle both at rest and at contraction. Even with solid clinical knowledge, much experience, and an astute eye, every patient comes with his or her blueprint. It is imperative that each time we, as injectors, stop, pause, and assess each patient's blueprint before we inject. I remember in kindergarten learning in the fire drill to stop, drop, and roll, while I often instruct novice injectors before they ever touch a syringe to stop, pause, and assess and honor each patient's individual blueprint. Now let's talk about 10 common mistakes when injecting neurotoxins. I'm going to begin by talking about 5 mistakes of doing or action mistakes, followed by 5 mistakes of not doing or inaction mistakes. Action mistake number 1, fortunately very rare, but most frequently reported. Neurotoxins injected in or near the upper eyelid levator muscle, resulting in transient upper eyelid ptosis. Approximately 5% of patients report transient upper eyelid ptosis, and it's the most frequently reported neurotoxin complication. Ptosis of the upper eyelid results from the migration of the neurotoxin to the levator muscle, which allows the eyelid to open functionally and properly. To avoid ptosis, injection should occur at least 1 centimeter above the eyebrow and should not cross the mid-pupillary line. A therapy recommended to treat ptosis from neurotoxins is the use of an alpha-adrenergic agonist called aproclonidine, 0.5%, 1 to 2 drops TID until the ptosis resolves. Action mistake number 2. Injecting the frontalis muscle instead of the corrugator muscle, resulting in Spock brows. Injectors attempting to inject the corrugator muscle instead often inject the lower portion of the frontalis muscle, causing the medial portion of the brow to descend and the lateral portion of the brow to arch upward unnaturally, causing Spock brows. I intentionally gently pinch the corrugators to get a good solid feel for it. It also distracts the patient from the injection and makes sure my injection is precise to avoid migration into the frontalis muscle. Action mistake number 3. Injecting the frontalis muscle too low, resulting in brow and/or upper eyelid ptosis or heaviness of the brow. I have observed many patients aged 50, 55, and older who often use their frontalis muscles to keep their eyes open. In these patients, relaxation of the frontalis muscle may result in ptosis of the brows and/or that upper eyelid heaviness. I personally stay high when injecting the frontalis muscle. When I ask my patients to lift their brows and contract that frontalis muscle, I intentionally inject above the lowest fold in their forehead. If the patient has low eyebrows, treatment of forehead lines should be avoided or limited, approximately 4 centimeters or more above the brow. When treating the forehead for the first time, I may reserve treating the forehead area for 2 weeks after injecting the glabellar area. Then I may advise initially starting with a lower dose in the forehead to reduce the chance of depressing that brow excessively. Action mistake number 4. Injecting too low in the orbicularis oculi muscles to treat crow's feet, resulting in exacerbation of under-eye laxity, also known as bags under the eyes. With age, our muscles weaken and collagen, which is a protein that gives structure to our skin cells, decreases, causing skin laxity and looseness. Beneath the skin and muscle, the main culprit for under-eye puffiness is fat, and the law of gravity is no respecter of fat. Fat displaces or migrates to surrounding tissues or both. In either case, neurotoxin injections can exacerbate under-eye issues if the inferior fibers of the orbicularis oculi muscles are relaxed. Action mistake number 5, using an excessively high dose, resulting in lack of expression. Some articles and textbooks recommend using a dose of 30 to 40 units of neurotoxin in the glabellar region, 25 to 30 units in the forehead, and 12 to 30 units in the crow's feet. I use, on average, 40% less in the glabellar, 60% less in the forehead, and it's about the same dose in the crow's feet. Consider your sources very carefully and attend continuing medical education conferences for trusted evidence-based data. I often will have patients follow up in 2 weeks after the initial treatment. Educate patients that less can be more. No complete paralysis. We always want to keep those expressions. Now to review the 5 mistakes of doing or action mistakes. Neurotoxin injection in or near the levator muscle is number 1, resulting in transient upper eyelid ptosis. Action mistake number 2, injecting the frontalis muscle instead of the corrugator muscle, resulting in Spock brows. Action mistake number 3, injecting the frontalis muscle too low, resulting in brow and/or eyelid ptosis or heaviness. Action mistake number 4, injecting too low in the orbicularis oculi muscle to treat crow's feet. This can result in exacerbation of under-eyelid laxity. And action mistake number 5, using an excessively high dose, resulting in lack of expression. Now let's cover 5 mistakes of not doing or inaction mistakes. Inaction mistake number 1, failure to inject wrinkles caused by neurotoxins. resulting in unnatural or new wrinkles. When certain muscles are relaxed with neurotoxins, the adjacent muscles increase in tone and compensate for the activity of the muscle treated. This compensation has a desirable softening effect or lifting effect, but also can create new wrinkles. The classic wrinkles caused by neurotoxins are bunny lines on the nose, which are caused by the contraction of the nasalis muscle. Sometimes after treatments of crow's feet, patients may notice increased fine wrinkles immediately below the infraorbital area. Inaction mistake number 2. Failure to differentiate between male and female eyebrows, resulting in masculinization of women's appearance or feminizations in men's appearance. A woman's eyebrow is commonly described as a seagull's wing, with the inner quarter sloping slightly up about 3/4 of the way and then the eyebrow descending down, whereas a man's eyebrow is straighter and closer to the upper eyelid. The eyebrows can be shaped by relaxing the frontalis muscle, which lowers the brow at the injection site, or by relaxing the superior lateral fibers of the orbicularis oculi muscle, which lifts the lateral portion of the brow. Inaction mistake number 3. Lack of familiarity with muscle contraction patterns, resulting in an unnatural appearance. The appropriate injection sites vary from patient to patient. The one-size-fits-all approach does not work with neurotoxins. Injectors should be familiar with the contraction patterns of the facial muscle groups in the upper, the middle, and the lower thirds of the face. I know in my experience, my patients appreciate it when I educate them and section the face into thirds. Inaction mistake number 4. Becoming complacent, resulting in careless errors. I myself have been guilty of this in the past. I have to often remind myself to stay mindful, stay intentional. The definition of complacency is really a feeling of quiet pleasure or security, often while unaware of some potential danger, defect, or the like. Once the fear is no longer preoccupying our actions, our minds can wander. Be intentional, be mindful. Please do not move your eyes before you move your hands. Why I love aesthetic conferences so much is because I always return with a healthy fear. Practice with respect, a healthy fear, and humility. Inaction mistake number 5. Failure to combine neurotoxins with other treatments, resulting in suboptimal results. Think of it as a buffet versus an a la carte. Neurotoxins are excellent for softening expression lines and enhancing certain facial features, including the brows, the nose, and the mouth. Combination of neurotoxins, dermal fillers, and quality skincare products, fractional laser and radial frequency treatments, etc., should be considered in combating the signs of aging due to volume loss, fat atrophy, bone resorption, and the inevitable effects of gravity. Now let's review the 5 inaction mistakes. Failure to inject wrinkles caused by neurotoxins. Number 1, resulting in unnatural or new wrinkles. Number 2, failure to differentiate between male and female eyebrows, resulting in the masculinization of women's appearance and the feminization of the men's appearance. Number 3, lack of familiarity with muscle contraction patterns, resulting in an unnatural appearance. Number 4, becoming complacent when the mind is not on the task, resulting in careless errors. And number 5, failure to combine neurotoxins with other treatments, resulting in suboptimal results. Now let's conclude. The objective in aesthetic medicine is to apply our knowledge, our skill set, and experience to establish and maintain clinical competence to improve our patients' quality of life, enhance their desire to age gracefully, and maintain a sense of wellness in all aspects of their lives. Thank you very much for joining me today for the 10 most common mistakes while injecting neurotoxins.